It's my pleasure to introduce our next speaker, the Health Information Management Manager at Dar Al Shifa Hospital. With 16 years of experience in healthcare and expertise as a certified nurse informatics professional, she was instrumental in implementing the hospital's electronic medical record system. Under her outstanding leadership, Dar Al Shifa became the first hospital in Kuwait to achieve HIMSS EMRAM and OMRAM Stage 7 certifications. She now leads initiatives in digital governance, data analytics, and AI, positioning the hospital at the forefront of healthcare technology. Today, she will share her insights on AI-driven advances in healthcare. Ladies and gentlemen, please join me in welcoming our very own Ms. Kris Suarez.
Hello. Good afternoon. It's always a joy to stand in this stage once again. It's our fourth International Nursing Conference. And really, we are building a strong community of nurses in Kuwait. And it makes me proud to be a part of that. So I'm Cherry, the HIM manager of Dar Al Shifa Hospital. So I am a nurse, as mentioned. And I am a board certified nurse informatics. So for those who are interested to enter in this field, in this afternoon, I will talk about AI-driven advances in healthcare. So I will touch a little bit about what is AI, but you have heard all about this whole day, right? And also about the advances, which a lot of the speakers have shown. And I will touch on how you would actually implement it if you've seen all these advances. So how do you actually bring it about in your own organizations? Well, I will not ask about the artificial intelligence. I decided on a different poll, which Ray will show. Okay, so just a quick show of hands. This is a test if you're listening. So artificial intelligence first was introduced, the term is first introduced. So just show of hands, I guess, right? For a show of hands for the audience in the room. And the ones online will fall. Okay, so the term artificial intelligence was first introduced in a 1900s, or the first is 1900s, in the 1950s, in the 1980s, or 1950s. Very good students. I thought I'll let you stay behind. Yes, that is correct, 1950s, with Alan Turing. I think some speakers touched on that. So it's not very, very new, right? So I'll show you. So I'll show you one example of a clinical decision support available in our hospital. So this is an alert to choose to the nurse for sepsis surveillance. So if you see here, I've blurred out the names of our patient. Here we'll show you the demographic. And here it tells the nurse that this patient has met some criteria that indicates inflammatory response syndrome. And please contact the physician and consider ordering and reviewing the following to evaluate for organ dysfunction. So all these orders. And here you find what actually made the patient qualify for this. So it's basically informing the nurse that your patient might develop sepsis, okay? Might go there. So call the doctor and check, if he wants to order these labs and evaluate the treatment. So how does this actually play? So I'd like to demystify how this rule actually comes and, pops up to the nurse. What happens in the background? It looks like this. So here, in the first row, you will see temperature. So there is an algorithm in our electronic medical record that checks for the temperature. Is it less than 36 or above 38.3 degrees Celsius?
So it needs us to do that.
No. Yeah, you better listen. I'll take a quiz after, huh? Pay attention. So then it also checks for the heart rate if it's more than 95 beats per minute. For the RR if it's more than 23. But you have to remember, or that the vitals change for the age group, correct? So you have to go back from the top. Is the age between, is it a newborn? Is it a neonate? Is it a pediatric? Is it an adult? And you go back from the top again, 1, 2, 3, and then you go down. Is the glucose between above 140 or below 200? But wait, is the patient diabetic? Because if it's abnormal, it doesn't mean it's sepsis. It means it's diabetes, right? So check, is there a history? Is there a diagnosis in the system? Oh, but maybe the doctor didn't document it. Doctors don't always document, right? Oh, then check, is there a history of taking anti-hypoglycemic agents? So then you go down. Is the WBC between this and this? But you have to remember that the WBC changed with the gender, if it's female or male. So you go back on the top again. This is how the rule works. And we are only in the first row. It's a big thing. And all the end of this is that small box that the nurse sees. So imagine how much this technology, clinical decision support, a component of artificial intelligence, actually relieves, opens up the hands of the nurse to give that actual face-to-face care because we have this technology in place. We have a lot of examples like this, hundreds, and some of the screenshots, examples shown by Dr. Kathy earlier, we have those as well. But this is more of the traditional instruction-based AI, meaning someone like me, I actually worked on this with our IT, gave the information, the clinical information, and then the programmer will come and program, right? So you give specific examples. And just to demonstrate that, I will borrow this concept that was shown by Cassie. She's a Google executive. She did an AI conference here in Kuwait, in AUM. And I found it a very effective demonstration of what AI is for non-technical people like us. So I'd like to do it this afternoon with you, okay? So now I am the programmer and you are my computer. You are my AI, okay? So I will program you and I will give you instructions so that you will then behave as my AI and answer my question, okay? So now the question is, what is a cat? So I will give you the description of what is a cat, and I will tell you that the cat can be identified by its triangular head, okay, with its upright ears, almond-shaped eyes, whiskers on its face, slender, flexible body, long tail, padded paws, and a coat. You understand the instructions? Yes. Okay, so then the first question. What is this? Cat. Very good. I'm a good programmer. Right? It's a cat. And this? Uh-huh. And this? And this? I didn't teach you to say dog. So it's when you program, it's 1 or 0. So it's cat or not cat. Okay, so are you sure? You're not convinced with this face? And this is? Not cat. How about this one? Big cat. So I have to go back. I have to check my programming, right? Now, in our layman's term, we'll call this a bug. When it does not behave according to what we want. It's simply bad programming. So I have to go back and add to my instruction something that will not eat you whole. That is what a cat would be. So this is how traditional AI works. Instruction-based. You have to give it the instruction and then it will carry out the task for you. But, so it's very limited, right? Because it will rely on how good you are in thinking of all the possible scenarios and highlighting it in your code. But instead of that, the newer generation of AI, the popular one is hot right now, is what we call the generative AI. So instead of learning from instructions, it can learn from examples. So instead of giving one by one, line by line, it can be given hundreds of thousands of data, large data available, and it will learn from that. It will identify the patterns. And as an example of a technology that learns from that is one of the use cases that we have at Dar al-Shifa also is in the radiology. So what you see here is an actual scan, and I've blurred out the name, of a color map, dynamic contrast, enhanced images for automated detection of prostate lesion. So it actually can trigger the radiologist to say, this image is suggestive of a lesion. Of course, it does not take away from that job, right, of the radiologist. And there are other AI capacity as well in radiology. And they have even taken now an open MRI with an AI aspect as well. And we have other healthcare uses of AI that are more of using the newer generation now of technology. So one, this in Care AI smart patient rooms, this uses computer vision. So the computer, with the camera can actually catch that this behavior is indicative of possible fall. So how would it be able to say it, right? So it can actually trigger the nurse in the station to say your patient might go for fall, so go there now. It will alert, and the nurse can run before it even happens. So it will identify signs of agitation, signs of restlessness, and factoring in the record inside the electronic medical record and give this scoring. So this is in the inpatient. And you have here Kate. Kate is actually popular. It's award-winning. It is a system that triages. So it will triage based on like the vitals, but also the unstructured data inside the electronic medical record. And then, so now, how do you triage now? You get some scores, right? You have different tools. Either it's a red, a green, a yellow, or a 1, 2, 3, 4. You score it. But this will take on that scoring plus other unstructured data in the electronic medical record. So this is in ED. This one is using a mobile app. It uses computer vision. So there are treatments where you would want to make sure the patient is really taking the medication. Like in my country, they would require the patient to go to the clinic, and it's called direct observed treatment, like to make sure that you're really drinking that medicine. So in other parts of the world, it's impossible to go to the clinic. So they would do pill count, automated pill dispensing, but this is which is used by NIH, they use the mobile phone. The computer vision will recognize that the pill the patient is taking is that pill that he's supposed to take, and that yes, he did swallow it. And then finally, this one is remote patient monitoring. So all these nice examples, right? Which actually really makes a difference in healthcare. But I guess the question now is, how do you go about in implementing it? So I'd like to highlight this here because I know, and as mentioned by my colleagues before me who spoke here, that nurses really are everywhere in the hospital. And we lead those discussions. Whatever advances those are, probably there's a nurse leading that initiative. So I know there are nurse leaders here. And later on, if you decide to take on AI in your own organization, so what are those parts to consider? There are three steps to AI implementation. First is you conduct a comprehensive needs assessment. You understand what is your gap. Next, you build your structure, integrated infrastructure, and then you train. First, conduct your needs assessment. So it's not anything and everything that you will put. You need to know what is it that moves the needle. Where is the need of the hospital? Because at the end, it's an investment and it is, expensive. So what are the things that, what is some criteria that you might want to consider? First is that AI to increase the productivity. Like a lot of the administrative tasks of the nurses, for example, can be taken away with AI. Or the example given on natural language processing, where the nurse will talk and the doctor will talk and the computer will listen and will automatically take this record, what you are saying, your assessment, transcribe it, and then put it in the EMR. So it takes away from that repetitive task. Next is complexity. As earlier someone mentioned about examining the whole, was it stroke? Yeah, stroke database of the whole of the country. So can that be done by a person? Yes, but it will take a lot of time, right? But using AI and for whatever the data that you have, this can be done in a relatively faster way. Amplification. Whatever skills that your caregivers have, multiply it, amplify it, make them faster. So for example, the sepsis one, makes you faster in giving care, in giving interventions. And finally, to bring about change, especially now with focus on patient engagement and personalized medicine. So what is the need? All these examples have already been provided earlier. So you pick and choose, right? Which one does your organization really need? Where does the gap lie? What problem do you want to answer? And then you build and integrate the infrastructure. So a quick definition of terms before we go there. So have you heard of these terms? Or no? Cloud. Ah, yeah. You hear cloud a lot, right? The cloud. So we have data lake, data warehouse. Data lake is a centralized repository that allows you to store all your structured and unstructured data. Structured meaning data that have label. For example, this is vital signs. This is demographic. Unstructured are the text blobs, like the free text ones that you would, write. Warehouse is specially designed for data analytics. So if the lake is just a lake, imagine bringing all the toys of your kids and putting it in a tub. That's a lake. All your data, demographics, everything in one place. But the warehouse is actually organizing it in cupboards. Now, this is all the patient demographics. This is all the vital signs. This is all the images in radiology. So you actually organize it so that it can be used for analytics. So that's warehouse. And then you have the cloud. The cloud refers to the delivery of computing services, including server, storage, database, over the internet. To summarize, simply it is a remote server, like not on site, but maybe in Germany or someplace else. Data is king. There is no AI without data, and data is a must. So you need to harness where your data is, right? So for us, for example, your electronic medical record. And if you're like us, we also have other systems for our like billing, for example, your patient satisfaction, or for example, your radiology. So there needs to be an integration between these systems for you to gather, to harness that data. You have to store it. So then where do you want to store it? You can store it on the cloud or on-prem, or on-prem is with you. So like it's more of like a question of what do you want, what do you need, what are the laws? If the laws say no, those data have to stay with you, so that should be on-premise. Data that can be stored somewhere else can be there. Like, there's a difference in like you have to pay someone to man your servers, or you just like pay someone else and they take care of the hardware and everything for you. And then should you do a warehouse and a lake? Put all the data in one place, or you continue to use them in the different places that they are. So these are questions that will be answered. And finally, high availability. You need to be safe. If something happens, it should be fault proof. There has to be redundancy or more than one places for cybersecurity reasons. It should be saved somewhere else. You know what this is? What is it? Yeah. It's a Ferrari, right? We have a favorite analogy here in our hospital. Whenever we come to big meetings talking about automation and all, we always refer to it as the Ferrari. So like we bought the Ferrari, so we imagine when we come up with automation solutions for our end users, we give them a big, workflow automated fully. So it's a Ferrari. So it's a garage full of Ferraris, right? But sometimes, as we mentioned, you need to do a needs assessment. Not everything has to be a Ferrari, right? So sometimes you just need a bike to get from one place to another. So it depends on what is the need. So, or maybe while we build your Ferrari, which takes time, like 6 months, maybe use this bike, right? But if you want generative AI, the likes that will, the one that we are all talking about now, will require a lot of resource intensive, like for the servers, for the GPUs, and for the cloud computing. So it is more akin to, if we refer to our analogy, to like a plane. It will bring you very far, very fast, turbojets. So I see Dr. Ahmad looking at me weird. So like, are you telling me to buy a plane now? We're not buy an airline. You don't need to buy the plane. Okay, you can rent the plane. So there are actually companies who provide all this for you. So you just pay for what you need, and all the hardware requirements of it will be provided to you. So there's a quick poll. And maybe, I believe AI is useful in healthcare. If you say yes only, just raise your hand. Otherwise, keep it down. AI is useful in healthcare. Okay, thank you. No judgment for those who did not raise their hands. It's totally fine. But here lies it's not an issue, but a point for discussion is that if us healthcare providers are like, iffy on it, how much more our patients, right? But I mean, would you? Like if you were the patient. So there's I think some of the ethical parts of it are discussed. But one key point is transparency. The AI part, you have to understand what it does and how it does it. Not in a technical way, but in a clinical way. And that has to be clear also to the patient. So one would be it should be mentioned in the consent and all. So like how I showed you the sepsis earlier, it's not a technical level, that's clinical. I was explaining you how clinically it works. So something like that. So as you build it, you need to make sure that you have compliance to the data regulation, data privacy, cybersecurity, encryption, and access control. So these are for security because data now is our biggest commodity, right? It is our magic crystal ball. Like predict for me what will happen. And this large data actually allows us to, take a peek of that. So it's very important that we keep it safe, the patient's privacy. And finally, scalability and future proofing. So I mentioned earlier, whether it's cloud or on-prem or, what would you want? This all talks about how big do you want to go later on. So can you work without data warehouse, without a data lake? Yes, it's possible. But then there are limitations to that. And so in the long run, it might be more expensive because you work, on creating AI algorithms here. You cannot really expand that. You'll be limited. So how big you want to grow it and to future-proof, because yes, it will grow. Technology will change. It's very fast in changing now. So if you lay out this groundwork of what you have, so it can be hybrid, you can have something locally and some on the cloud, it will give you that leverage to work with the available technology and the available data. And finally, you train, monitor, optimize. So if I refer this back to the nursing process, so we have discussed about assessment, right? You assess your needs. And then you prepare your materials, right? So you have your technology, you have your data, and then you have your hardware part of it. And now you will perform the procedure. So you can hire a data scientist, and also pay for these services for the AI deployment tools, but also there are companies who do this actually for you. So you can pay them and they have their own data scientists, own models that they can bring and put in the data that you have and work from there and learn from there, because it's some are continuously learning. And staff training. The staff needs to have that understanding. It's part of our ethical responsibility to our staff and, of course, to our patients. And in whatever you implement, we do not forget to use the PPT framework. People, process, technology. We always check with the people first. What do you need? And then you structure your process. The technology should not dictate the workflow, should not dictate the people how to do the job. It should be the other way around, because technology is just a tool to make it work better, not force for the end users, for your nurses. AI is not panacea. It's not the solution to all the problems. And if you see this tower, the red one is the AI. So your whole process, your workflows, the clinical competency of your staff, AI is just one tiny bit of that. It does not define everything. And neither will it solve also everything. I will close with this. This is my last slide on Amara's law. Roy Amara is a scientist and American scientist. In the 1970s, he said this. We tend to overestimate the effect of technology in the short run and underestimate the effect in the long run. So here in the graph, the perceived benefit is this linear blue, and the actual benefit is this orange. So in the short term, especially now where we are, there's a lot of excitement and a lot of hype that often this excitement overshadows the limitations and the concerns that are currently, we are facing. The ethical questions of how to proceed with this. And also there is this thinking of a sweeping change. Like, oh, ChatGPT, oh, everything. We have to understand that the AI technology's effect will be incremental. As with it's at its infancy, but we will see it do the changes little by little. However, in the long run, it could potentially change everything. In the long run, it could change how we do and impact, complex human health problems. So as we move along, we should be mindful to have that balanced perspective, to be cognizant of the potential, but also the limitation and our ethical responsibilities that lie. Thank you very much.
Cheryl, that was a very interesting and very engaging presentation. And for that, thank you.